as healthcare systems right across Africa face the growing pressures. One local innovator is challenging the status quo, not with more hospital beds, but by bringing hospital-level care directly to people's homes. Well, today we're very pleased to be joined by Dr. Vuyane Mhlomi, co-founder of Quro Medical, to discuss how technology is actually transforming healthcare delivery through their groundbreaking hospital-at-home model. From cutting costs to improving patient outcomes, Dr. Vuyane is helping shape a more inclusive, accessible, as well as compassionate healthcare future. He joins us live in studio to further unpack this in studio. Doctor, it's a great pleasure to have you with us. Welcome to SA Today.
Thank you so much for having me, and good afternoon to your viewers.
Good afternoon. So, Doctor, yesterday we covered a very interesting story whereby they were talking about the fact that, diseases like hypertension and other popular diseases, specifically that are associated with, certain demographics or in the areas that we come from, can actually be better managed. But it's the fact that people don't have the knowledge and the wherewith and know-how on how to actually maintain them that is making it more deadly. So briefly take us through the objective behind this alternative to normal healthcare service. Why is there a need for projects such as yours where you are bringing the hospital bed to the house?
Well, firstly, the reality is that when healthcare was first conceived, patients were actually treated at home, right? In fact, it was the preserve of the elite and the aristocrats back in the day because the outcomes were better. We introduced hospitals because they were meant to be the most efficient way to look after people, particularly the indigent. The reality, however, today is that hospitals have become increasingly expensive. They're not always safe for a lot of the patients. And I think there's a point of diminishing returns where you are looking after patients in the traditional brick and mortar facility, after which those patients tend to recover and do better at home. And so with the sort of influx of time and what we've seen is that actually with technology, patients can now be looked after at home. So doctors tend to be a lot more reluctant to discharge patients or look after patients at home because they are blind to what is happening in the at-home environment. And yet often the triggers or the drivers for hospitalizations happen in communities where we often don't have sight.
True.
Enter technology, right? So today we're able to provide real-time monitoring of patients in the comfort of their own homes, and that's exactly what Quro Medical does. And how we do so is that if you're unwell, you wouldn't ordinarily go to your doctor. They would do a full clinical assessment, make the diagnosis, and what we then do is that instead of admitting you into the hospital environment, we would then admit you to your home, right, where you're surrounded by your family. We dispatch a dedicated clinical team that comprises of medical doctors, clinical associates, nurses, who then meet you at home. We connect you to our wearable technology. These are clinical grade portable devices that sit on your body. An example of this is a device called the Vital Patch, and this is a chest biosensor. What this technology does is that it allows us to collect all the different physiological parameters that normally change when a patient is unwell or even when they're well. So for example, if you would go to the hospital, you would notice that most patients are connected to machines.
Oh yeah.
Well, what we do is that now we collect data from the patients. It's transmitted to a 24-hour command center that is run by qualified healthcare professionals, and it's streamed in real time. So when a patient runs into trouble while they're at home, we can not only respond, but we can also anticipate that the patient is going to run into trouble, and we're able to dispatch the necessary resources and people, for example, emergency medical services, who can respond to these patients as and when they need to.
That is great, Doctor. I mean, in the recent GEM Symposium, when you tabled your presentation, there were hard questions around the feasibility of this, specifically in regards to South Africa suffering still with infrastructural challenges. So we have a sluggish economy and a slew of those infrastructural challenges. So just how feasible is home-based care?
Well, as feasible as we've been doing this thing for the past 7 years, right? In the middle of COVID, throughout what do you call load shedding.
How come we don't know about this, Doctor?
Absolutely, because I think the nature of our work is that we spend quite a bit of our time trying to build and find partners in the space that would demonstrate that this model can be run effectively within South Africa. And so we started in the private healthcare sector, partnering with the likes of GEMS and a few other with medical schemes in the private sector, allowing us to look after patients in different environments.
And very quickly in closing, Doctor, I mean, futuristically, I mean, those who suffer mostly are those communities in far-flung areas or townships. They do not have the necessary access or even financial backing to actually go and even take a taxi to go and consult a doctor. So how are you then trying to go and bridge this accessibility, affordability gap that is currently existential within our healthcare system? And also, are you looking at branching out with, of course, the various health bodies and entities, specifically the South African, the Department of Health in South Africa, to ensure that you actually reach those intended targets?
So let me just start with the last question first and say, yes, we would love to partner with the Department of Health and the exploratory conversations that we're having with the various provincial governments of health. A lot of our patients that we look after live in the different places in South Africa, from Dobsonville to Khayelitsha, Houghton, Sandton, Somerset West.
They're everywhere.
Really, we're everywhere. And our role was initially to focus on the sort of the metropolitan areas. We then moved across to the peri-urban communities. And the real challenge for us now is to look at how do we reach patients in the far-flung areas and what we call the last mile of health. And we can only do so through collaboration. And we would like to invite the Department of Health to partner with us and collaborate with us so that all patients that need these kind of services are reached.
All right. Well, Doctor, all the best of luck with this initiative. Hopefully, we will be getting a report back soon about your future collaborations, as of course uttered here during this interview. That is Dr. Vuyane Mhlomi, who is the co-founder of Quro Medical, on efforts to bridge the healthcare divide in the country by, of course, offering an affordable, accessible home-based care alternative to healthcare.